So the use of circulating tumor cells, in particular with regard to the enumeration, always focused primarily on single cells. But while we were studying single cells enumeration, we also noted that with the cell search, there were actually clusters of cells, 2 or 3 cells coming together and clusters together, and these were all cytokeratin positive, CD45 negative. So we started to look at the detection of these cells or this cluster with cells, and we start to look at the prognostic implications. And we saw that in fact patients that have more than 5 CTC and they have also clusters do worse compared to the patients that have 5 CTC and do not have clusters. So this clearly brought up the issue of biology. What brings the cells together? What drives the CTC clusters? And what can we do to actually use these cells as a marker for some specific therapies? So with collaborators at Northwestern University, we identify some adhesion molecules that are important, like CD44, to in the formation of the clusters when the cells extravasate. And also we found the cells in the peripheral blood as well as in the organs that were affected by metastasis. We went back to the lab, we saw this in vivo animal models, and so we formulated an hypothesis with regard to the role of this adhesion molecule and the possibility that in fact a treatment would be effective if we were to affect the clusters with specific anti-CD44 therapies. And finally, we look at the possibility that, in fact, these clusters can be treated with other medications that are used for other treatments right now with other indications or repurposing drugs. So we think that really the clusters are the seeds of metastasis. They are one possible way for which metastasis develop faster in some patients predisposed to. Of course, the next question is, can we identify mutations that are associated with clusters? And we did that, in fact, combining cell-free DNA information with CTC cluster detection. We saw that some mutation, for example, ESR mutations and CDH1 mutation, typical for lobular cancer, appear to be more associated with clusters. We also found that, for example, other type of expression of biomarker in the CTC, like the HER2 expression CTC, is associated with clusters. So all indicate, in fact, that a biological, more aggressive disease will at some point be associated with the visible presence of clusters. So this obviously suggests that we don't have to necessarily develop different type of therapy for cluster. We can target this HER2 or HER2 low expression, or we can target this mutation that are present in the peripheral blood, like ESR mutation for ER positive disease.